This well-known doctor who treated patients effectively also killed many of them intentionally. We're talking about Harold Shipman, or Dr. Death. Born in January 1946 in Nottingham, England, and died in January 24. He was a doctor and a serial killer who murdered 250 patients. Shipman's murders raised troubling questions about the powers and responsibilities of the medical community in Britain and about the adequacy of procedures for certifying sudden death. He was born in a working middle class in Manchester. He was a bright child and got interested in medicine after seeing his mother, who was suffering from lung cancer, injecting herself morphine. Just to ease the pain and the suffering until she died. In 1970, he received his medical degree from Leeds University, and then later on, he started practicing general medicine in Lancashire. After he was discovered that he had written several fraudulent prescriptions for the opiate pethidine, to which he had become addicted, he was forced out of his practice and into rehab center. But then again, in 1977, he was found to be practicing general medicine in Manchester, Greater Manchester. And there he gained respectability and a thriving practice. Until 1998, when one of his patients, an 81-year-old female, she was found dead in her apartment just few hours after his visit. Her family was perplexed by the suddenness of her death. She had appeared to be in good health by the fact that her will had been changed to benefit Shipman, and by Shipman's insistence that no autopsy should be done. In the year 2000, he was convicted on 15 counts of murder and 1 count of forgery and sentenced to life in prison, where he committed suicide, hanging himself in his cell. So a government inquiry was ordered just to know how many more patients he killed. And in 2005, an official report stated that an estimation of around 250 patients were killed and murdered by this doctor. And in most of these cases, Shipman injected high lethal doses of diamorphine and then signed death certificates attributing the incident to just natural causes. In fact, his motives were unclear and many theories arose. Some speculated that Shipman may have been seeking to avenge the death of his mother, while others suggested that he thought he was practicing euthanasia. And the third possibility raised was that he derived pleasure from the knowledge that, as a doctor, he had the power of life or death over his patients, and that killing was the means through which he expressed his power. And despite one forgery, financial gains did not seem to be a serious motive. Yeah, what are your thoughts on this crazy story? Don't forget to subscribe for this new series of stories in medicine.